The emergency room at Mercy General Hospital in Cedar Falls, Virginia, was never quiet on a Friday night. Ambulance sirens wailed outside. Doctors shouted orders. Nurses rushed between beds with trays of medicine and equipment. It was controlled chaos, the kind that happened every weekend in this small military town. Sarah Mitchell walked through the automatic doors at exactly 6 o'clock in the evening. She wore fresh blue scrubs and white sneakers that squeaked slightly on the polished floor. Her dark hair was pulled back in a simple ponytail. At 42 years old, she had kind eyes that crinkled at the corners and hands that were steady and sure. She approached the nurse's station with her paperwork. A young woman behind the desk barely looked up. "I'm Sarah Mitchell," she said quietly. "It's my first day." The receptionist pointed down the hallway without making eye contact. "Nurse's locker room is that way. Report to Dr. Hammond when you're ready." Sarah nodded and walked away. She had learned long ago not to expect warm welcomes. She was used to proving herself. In the locker room, she stored her bag and pinned her name tag to her scrub top. She stared at it for a moment, just her name, nothing else. That was how she wanted it. When she returned to the emergency department, 3 doctors stood near the central desk. They were young, probably in their early 30s. They wore expensive watches and had the confident posture of men who had never been told no. "That's the new nurse," one of them said, loud enough for Sarah to hear. His name tag read Dr. Kevin Hammond. He had blonde hair styled with too much gel. "She looks old," another one said. This was Dr. Marcus Chen. He smirked as he flipped through a patient chart. The third doctor, Dr. James Porter, laughed. Where did they find her? A retirement home. Sarah kept her face blank. She had heard worse, much worse. She walked up to them and stood at attention, waiting. Dr. Hammond finally acknowledged her. "You're the new hire, Sarah Mitchell." "Yes, doctor." "Where did you train? What's your experience?" "I have 20 years of emergency medical experience," Sarah said evenly. "I'm certified in trauma care, advanced cardiac life support, and pediatric emergencies." Dr. Chen raised his eyebrows. 20 years? Doing what exactly? You look like you've been out of the field for a while." "I've been working continuously, doctor." "Where?" Dr. Porter pressed. "Which hospital?" Sarah paused for just a moment. "I worked in various field hospitals, trauma units, high-stress environments." Dr. Hammond laughed. "Field hospitals, what does that even mean? Listen, Mrs. Mitchell." "Ms. Mitchell," she corrected gently. "Whatever, this is a real hospital. We have standards here. We have protocols. I don't know what kind of relaxed environment you came from, but here we do things the right way. My way. Understood?" Sarah nodded. "Understood, doctor." "Good. Start by restocking the supply closets. Then you can shadow Nurse Johnson and learn how we do things here." It was busy work. Sarah knew it. The kind of tasks they gave to people they didn't respect. But she simply said, "Yes, doctor," and walked away. The night progressed slowly. Sarah restocked supplies. She organized medicine cabinets. She watched the other nurses work while the 3 doctors continued to make comments just loud enough for her to hear. "She moves like a grandma," Dr. Chen said during a quiet moment. "Probably can't keep up when things get serious," Dr. Porter added. Dr. Hammond was the worst. Every time Sarah walked past, he found something to criticize. Her posture, her speed, the way she organized equipment, nothing was good enough. The other nurses were kind but distant. They had worked with these doctors for years. They knew not to make waves. One older nurse named Patricia whispered to Sarah during a break, "Don't let them get to you, honey. They're like this with everyone new, especially women over 30. Sarah smiled. "I can handle it." "I'm sure you can," Patricia said, studying Sarah's face. "You have that look like you've seen things." Sarah didn't respond. She had seen things. Things that would make these doctors cry, but that wasn't why she was here. She was here to heal, to help, to serve quietly, just like she always had. 2 weeks passed. Sarah worked every shift without complaint. She arrived early and stayed late. She never argued with the doctors, even when they were clearly wrong. She simply did her job with quiet efficiency. But Dr. Hammond and his friends didn't stop. If anything, they got worse. "Sarah, did you sterilize these instruments?" Dr. Hammond demanded one evening, holding up a tray. "Yes, doctor, according to protocol." "Do it again. They don't look clean enough to me." Sarah took the tray without a word. She sterilized the instruments again, even though they were already perfectly clean. Dr. Porter watched with a satisfied smile. "She's very obedient," he said to Dr. Hammond, "like a trained dog." Dr. Chen laughed. "More like an old dog, can't teach her new tricks." The other nurses looked away uncomfortably. They had grown to like Sarah. She was kind and hardworking. She helped without being asked. She knew things, too, medical things. Sometimes she would quietly suggest a treatment or catch a mistake before it happened. But she never took credit. She never made a fuss. Patricia cornered Sarah in the supply room one afternoon. "Why do you let them treat you like that?" "It doesn't matter," Sarah said simply. "Of course it matters. You're twice the nurse any of these young girls are, no offense to them. You know more than those arrogant doctors. I've watched you. You see things they miss." Sarah smiled softly. "I'm not here to prove anything, Patricia. I'm here to help patients." "But don't you have any pride, any self-respect?" "I have plenty of both," Sarah said quietly. "I just don't need to prove it to men like them." Patricia shook her head but didn't push further. There was something about Sarah Mitchell that didn't quite add up. She was too calm, too steady, too comfortable with disrespect, like she had been through something that made hospital politics seem trivial. The real test came on a Thursday night. The emergency room was packed. A car accident on the highway had sent 6 people to the hospital all at once. Blood, broken bones, screaming family members. Pure chaos. Dr. Hammond was in his element, shouting orders and rushing between beds. Dr. Chen and Dr. Porter worked quickly but were clearly overwhelmed. Nurses ran in every direction. Sarah moved through the chaos like water flowing around rocks, calm, efficient, invisible. She was checking an IV line when she noticed something. A young man in bed 7, early 20s. He had been brought in from the accident with minor injuries, cuts and bruises, but something was wrong. Sarah walked closer. His breathing was shallow. His lips were slightly blue. The monitors showed normal vital signs, but Sarah's instincts screamed danger. She checked his pupils, uneven. She pressed on his abdomen, rigid. Internal bleeding. The impact from the crash had caused internal damage that wasn't visible on the outside. He was bleeding into his abdomen. He would die in minutes if they didn't operate immediately. Sarah rushed to Dr. Hammond. "Doctor, the patient in bed 7 needs immediate surgery. Internal bleeding, likely splenic rupture." Dr. Hammond was suturing a cut on another patient. He didn't even look up. "He's stable. Minor injuries only. Don't bother me with nonsense." "Doctor, please. His symptoms indicate." "I said he's fine," Dr. Hammond snapped. "I examined him myself. You've been here 2 weeks and you think you can diagnose better than me. Get back to work." Sarah stood frozen for a moment. She looked at the young man in bed 7. He was fatting. She could see it. She made a decision. Sarah walked directly to the nurse's station and picked up the phone. She called the surgical unit directly. "This is Sarah Mitchell in the ER. I need an emergency surgical team to bed 7 immediately. Suspected splenic rupture with internal hemorrhage. Patient is critical." The surgical nurse on the line hesitated. "Did Dr. Hammond order this?" "No, I'm ordering it. Get a team down here now." Dr. Hammond appeared beside her, his face red with fury. "What do you think you're doing?" "Saving a life, doctor." You don't have the authority to call surgery. You're a nurse. You work for me." "That patient is dying," Sarah said, her voice still calm but now with steel underneath. "You missed it, I didn't." The surgical team arrived within 2 minutes. They took one look at the patient and rushed him to the operating room. Dr. Hammond stood speechless. 2 hours later, the surgeon called down. "We removed his spleen. He had ruptured it in the accident. Another 10 minutes and he would have bled out internally. Good catch." Dr. Hammond stared at Sarah across the emergency room. His face was a mixture of anger and humiliation. She had been right, he had been wrong, and everyone knew it. After that night, everything changed, but not in the way Sarah had hoped. Dr. Hammond didn't apologize. He didn't thank her for saving the patient's life. Instead, he became colder, meaner, more determined to put her in her place. "You got lucky," he told her the next shift. "Don't let it go to your head." Dr. Chen and Dr. Porter followed his lead. They started documenting everything Sarah did, looking for mistakes. They questioned every decision. They gave her the worst assignments, the most difficult patients, the messiest rooms. They were trying to break her. One evening, Dr. Hammond called her into his office. It was small and cluttered with medical journals and coffee cups. He sat behind his desk with his arms crossed. "Sit down, Ms. Mitchell." Sarah remained standing. "I prefer to stand, doctor." His jaw tightened. "I've been reviewing your file." "All right. You have an impressive resume, 20 years of trauma experience, multiple certifications, but there are gaps, long periods where you don't list a specific employer. Care to explain?" "I worked in field hospitals, doctor, as I mentioned." "That's vague. Which field hospitals? Where? Who was your supervisor?" Sarah met his eyes steadily. "That information isn't relevant to my current position." "I think it is. I think you're hiding something. Maybe you were fired. Maybe you lost your license and got it back. Maybe you're not as experienced as you claim." "I have all my certifications in order. Human Resources verified everything." Dr. Hammond leaned forward. "Here's the thing, Ms. Mitchell. You may have fooled HR, but you don't fool me. You embarrass me in front of my colleagues. That doesn't happen twice. Step out of line again and I'll have you fired. Are we clear?" Sarah was quiet for a long moment. When she spoke, her voice was soft but firm. "Dr. Hammond, I'm not your enemy. I'm here to help patients. That's all I've ever done." "Then stay in your lane," he snapped. "You're a nurse, act like one." Sarah left his office without another word. Patricia was waiting in the hallway. She had heard everything. "Why don't you report him?" Patricia whispered urgently. "This is harassment. This is hostile work environment. You could sue." "I'm not going to sue anyone," Sarah said. "Then at least defend yourself. Tell them who you really are." Sarah turned to look at her friend. "Who do you think I really am, Patricia?" The older nurse hesitated. "I don't know exactly, but I know you're not just some nurse. The way you move, the way you assess patients, the way you handle stress. You've been in combat, haven't you?" Sarah didn't answer directly. "My past doesn't matter, only the present." "Your past matters when doctors are trying to destroy your career." "They can't destroy something I don't need validation for," Sarah said simply. "I know who I am. That's enough." But it wasn't enough for everyone else. Rumors started spreading through the hospital. Some nurses whispered that Sarah had been dishonorably discharged from the military. Others said she had been fired from her last 3 hospitals. Dr. Hammond made sure these rumors reached the hospital administrator. Sarah heard them all. She said nothing. She simply kept working, kept helping patients, kept showing up every single day with the same quiet strength. One young nurse named Emily approached her during a break. Emily was 24, fresh out of nursing school, and terrified of the doctors. "Ms. Mitchell, can I ask you something?" "Of course, Emily." "How do you do it? How do you stay so calm when they're so mean to you?" Sarah poured herself a cup of coffee and thought about the question. "I've been through worse," she said finally. "Much worse. These doctors think words can break me, but I've survived things that actually break people. Their insults are just noise." "Were you in the military?" Emily asked quietly. Sarah smiled but didn't answer. "Why do you ask?" "You stand differently than other people, and you never panic. Even when everyone else is panicking, you're completely calm. My brother is in the army. He stands like you do." "I served," Sarah admitted, "a long time ago." "What did you do?" "I helped people who were hurt, same as now." Emily nodded slowly. "I think you were more than just a medic." Sarah sipped her coffee. "We should get back to work." That Friday night, the hospital was unusually busy again. Flu season had hit hard, and every bed was full. Sarah worked a double shift without complaint. She was checking on an elderly patient when she heard shouting from the entrance. "I need a doctor now." Sarah rushed to the emergency entrance. Two military police officers were helping a man in uniform through the doors. He was bleeding heavily from his shoulder. His face was pale. His uniform identified him as Navy. "Gunshot wound," one of the MPs said quickly. "Accident at the base firing range. He's lost a lot of blood." Sarah immediately took charge. "Get him on a gurney, someone page surgery." She cut away his uniform sleeve while other nurses hooked up monitors. The wound was serious but not fatal if they acted fast. Dr. Hammond appeared, looking annoyed at being interrupted. "What's all the commotion?" "Gunshot wound to the shoulder, doctor. He needs immediate surgery." Dr. Hammond looked at the patient dismissively. "Stabilize him first. Surgery can wait 20 minutes." "Doctor, he's lost significant blood. We need to operate now." "I'll decide when we operate, Nurse Mitchell." Sarah locked eyes with him. "With respect, doctor, this patient will go into shock if we wait. He needs surgery immediately." The two MPs watched the exchange with growing alarm. Dr. Hammond stepped closer to Sarah, his voice low and threatening. "You're doing it again, questioning my authority. This is your last warning." Sarah didn't back down. "This is a military serviceman. He deserves the best care possible, right now." "Take your hands off my patient," Dr. Hammond ordered. Sarah didn't move. The standoff lasted only seconds, but it felt like hours. Then a voice came from the gurney, weak but clear. "Mitchell, Sarah Mitchell." Everyone turned to look at the wounded man. His eyes were open now, focused on Sarah's face. Recognition dawned slowly, followed by something like awe. "Commander Mitchell," he whispered, "is that you?" Part 4, The Truth Revealed. The emergency room fell completely silent. Dr. Hammond looked confused. "Commander, what are you talking about?" The wounded man tried to sit up, but Sarah gently pressed him back down. "Stay still, sailor. You need surgery." "But ma'am, I didn't know you were here. I served on the USS Mercy when you—" He winced in pain but kept talking. "You saved our entire unit in Afghanistan. You're a legend." Dr. Hammond's face went white. "What is he talking about?" One of the military police officers stepped forward. His eyes were wide as he stared at Sarah. "Wait, are you Commander Sarah Mitchell, the Navy SEAL medical officer?" Sarah closed her eyes briefly. Her carefully guarded secret was about to come crashing down. "Former," she said quietly. "I'm retired now." The MP's jaw dropped. "You were a SEAL, a female SEAL." "Medical officer attached to SEAL Team 3, Sarah corrected. "Now please, this man needs surgery." But the wounded sailor wasn't done. Despite his pain, he kept talking. "Dr. Hammond, sir, do you know who this woman is? She ran into enemy fire to pull out 6 wounded operators. She performed surgery in the back of a helicopter under fire. She has 2 bronze stars and a silver star. She's a genuine hero." The other nurses had gathered around now. Emily's mouth hung open in shock. Patricia had tears in her eyes. Even the cynical veteran nurses looked stunned. Dr. Chen spoke up, his voice uncertain. "This must be a mistake. She's just a nurse. She's been restocking supplies for 2 weeks." The wounded sailor actually laughed, though it turned into a cough. "Just a nurse, sir. Commander Mitchell has more combat medical experience than every doctor in this hospital combined. She trained with the best trauma surgeons in the military. She's board certified in emergency medicine. She chose to work as a nurse. She didn't have to." Dr. Hammond looked like he might be sick. "Why didn't you tell us?" Sarah met his eyes steadily. "Because it doesn't matter. I'm here to help patients, not to impress doctors." "It does matter," Dr. Porter said quietly. He looked ashamed. "We treated you terribly." "You treated me like you thought I deserved," Sarah said simply. "That says more about you than it does about me." The MP officer suddenly snapped to attention and saluted Sarah. It was crisp and formal. "Ma'am, it's an honor. Thank you for your service." Sarah didn't return the salute. "I'm a civilian now." "But thank you." "Once a SEAL, always a SEAL, ma'am." Sarah turned back to the wounded sailor. "All right, enough talking. You're losing blood and I'm losing patience. We're taking you to surgery now, with or without Dr. Hammond's permission." But Dr. Hammond had already picked up the phone. His hand shook slightly as he called surgery. "This is Dr. Hammond. Emergency surgery needed immediately. Gunshot wound, shoulder, significant blood loss. Prep an OR now." He hung up and looked at Sarah. For the first time since she'd arrived, there was no arrogance in his eyes, only shame. "I'm sorry," he said quietly. "I was wrong about everything." Sarah nodded once. "We'll talk later. Right now, we have a patient to save." The surgical team arrived and took the wounded sailor away. As they wheeled him out, he lifted his good arm in a weak salute to Sarah. "Hooyah, Commander." Sarah smiled. "Hooyah, sailor, you're going to be fine." After he was gone, the emergency room remained eerily quiet. Everyone was staring at Sarah. She suddenly felt more exposed than she ever had in combat. Emily was the first to speak. "You were a Navy SEAL, but women couldn't be SEALs until recently." "I wasn't a SEAL operator," Sarah explained patiently. "I was a medical officer attached to SEAL teams. I went through modified SEAL training so I could deploy with them. It's not the same thing, but the training was real enough." "Why did you retire?" Patricia asked gently. Sarah's face clouded. "I lost someone, a young operator. He was hit by an IED and I couldn't save him. He was 23 years old. After that, I realized I'd been at war for almost 20 years. I needed to come home, to heal regular people in regular places." "So you became a nurse?" Dr. Chen asked, still looking confused. "I've always been a nurse," Sarah said. "Being in the military didn't change that. I took care of people. That's all I've ever wanted to do." Dr. Hammond sat down heavily in a nearby chair. He put his head in his hands. "I've been such a fool." "Yes," Sarah agreed, "you have been." He looked up at her, surprised by her bluntness. "But you can change," Sarah continued. "You're a good doctor, Dr. Hammond. I've watched you. You're skilled and fast, but you're arrogant and cruel. You use your authority to hurt people instead of helping them. That needs to stop." "You're right," he admitted quietly. "I don't know what to say." "You don't have to say anything to me," Sarah told him. "But maybe think about how you treat the next person who walks through those doors looking for a job. The next person who seems different or old or not impressive enough. Maybe give them a chance before you judge them." Dr. Porter stepped forward. "Commander Mitchell, I mean Ms. Mitchell, I owe you an apology too. We all do. What we did was inexcusable." "Apology accepted," Sarah said simply. "Now can we all get back to work? We have patients who need us." The nurses began to disperse, though they kept glancing back at Sarah with new eyes. Emily lingered behind. "Ms. Mitchell, you're my hero," she whispered. Sarah smiled and touched the young nurse's shoulder. "I'm not a hero, Emily. I'm just a nurse who showed up and did her job, same as you do every day. That's all any of us can do." But Emily shook her head. "No, ma'am, you're more than that. You're proof that women can do anything, that we don't have to prove ourselves to men who don't respect us. We just have to know our own worth." Sarah felt unexpected tears prick her eyes. "Thank you, Emily. That means more than you know." News of Commander Sarah Mitchell spread through Mercy General Hospital like wildfire. By the next morning, everyone knew. The quiet, unassuming new nurse was actually a decorated combat veteran with more experience than most of the staff combined. The hospital administrator, Mrs. Helen Brennan, called Sarah into her office first thing Monday morning. Mrs. Brennan was a stern woman in her 60s who ran the hospital with military precision. Ironically, she was a retired Army colonel herself. "Sit down, Commander," Mrs. Brennan said. "It's just Sarah now, ma'am." Mrs. Brennan smiled slightly. "Once an officer, always an officer. I recognize that look. I wore the same uniform for 30 years. She folded her hands on her desk. "I owe you an apology. When you applied for the nursing position, your resume was impressive but vague about your military service. I should have dug deeper. I should have understood what you'd been through." "You had no reason to," Sarah said. "I didn't want special treatment. But you deserved basic respect, and from what I hear, you didn't get it." "I've faced worse than a few arrogant doctors, ma'am." Mrs. Brennan leaned forward. "I'm sure you have, but that doesn't make it acceptable. Dr. Hammond, Dr. Chen, and Dr. Porter will all be receiving formal reprimands in their files. They'll also be required to complete sensitivity and workplace respect training." "That's not necessary," Sarah began. "Yes, it is," Mrs. Brennan interrupted firmly. "What they did was harassment. It violated hospital policy. More importantly, it violated basic human decency. If you choose to pursue further action, I'll support you fully." "I don't want to pursue further action," Sarah said. "I just want to do my job." Mrs. Brennan studied her for a long moment. "You remind me of myself 30 years ago, trying to prove you belonged in a man's world by being tougher than all of them, never complaining, never showing weakness." "It worked, didn't it?" Sarah asked. "It worked," Mrs. Brennan agreed. "But it also cost me 2 marriages, relationships with my children, my own sense of self-worth beyond my uniform." She paused. "Don't make my mistakes, Sarah. You're retired now. You're allowed to be human. You're allowed to stand up for yourself." Sarah was quiet for a moment. "I'll think about that, ma'am." "Good. Now I have a proposal for you. We're opening a new trauma unit specifically for veterans. PTSD treatment, physical rehabilitation, substance abuse counseling. We need someone to head up the medical side. Someone who understands what veterans have been through. Someone they'll trust." Sarah's eyes widened. "You want me to run it?" "You'd be perfect. It would be a nurse manager position, but you'd have significant autonomy. And you'd work with veterans every day, using all that experience you've been hiding." "I'd need to think about it," Sarah said carefully. "Of course, take your time." Mrs. Brennan stood and offered her hand. "Whatever you decide, thank you for your service, both to your country and to this hospital." Sarah shook her hand and left the office with her mind spinning. Down in the emergency room, things had changed dramatically. Dr. Hammond approached her as soon as she arrived. "Ms. Mitchell, could I speak with you privately?" They stepped into an empty examination room. Dr. Hammond looked like he hadn't slept in days. "I've been thinking a lot about what you said," he began. "About being arrogant and cruel. You were right. I've been treating people terribly for years, and I justified it by telling myself I was just maintaining standards. But really, I was just being a bully." Sarah listened without interrupting. "My father was a surgeon," Dr. Hammond continued. "A famous one. He always told me that doctors were gods and everyone else was beneath us. I grew up believing that. But watching you these past weeks, especially that night when you diagnosed the internal bleeding I missed. I realized how wrong I was. You're a better doctor than I'll ever be, and you don't even have an MD. I'm not a doctor, Sarah corrected gently. I'm a nurse. There's a difference, and it's not about better or worse. We have different roles. But you saved that patient's life when I was too arrogant to listen. Then learn from it, Sarah said. Be better, listen to the people around you. Nurses see things doctors miss because we spend more time with patients. We're not lesser, we're partners. Dr. Hammond nodded slowly. I want to learn. From you if you'll let me. Not medical skills, I mean, but how to be humble, how to serve instead of just commanding. Sarah was genuinely surprised. That's very mature of you, doctor. Will you help me? She considered for a moment, then smiled. I'll try, but you have to do the real work yourself. Over the next several weeks, the atmosphere in the emergency room transformed. Dr. Hammond began asking nurses for their input instead of just barking orders. Dr. Chen and Dr. Porter followed his lead. They made mistakes and backslid sometimes, but they were genuinely trying. Emily and the other young nurses blossomed under Sarah's quiet mentorship. She taught them to trust their instincts, to speak up when something felt wrong, to see their work as a calling rather than just a job. Patricia told Sarah one evening, "You've changed this place. People actually want to come to work now." I didn't do anything special, Sarah insisted. That's where you're wrong, Patricia said. You showed everyone what real strength looks like, not the loud, aggressive kind, the quiet kind, the kind that doesn't need recognition or titles, the kind that just shows up every day and does what's right. Sarah accepted the position heading the new Veterans Trauma Unit. On her first day in the new role, a surprise visitor arrived. The wounded sailor she'd treated weeks earlier walked into her office in dress uniform. His arm was in a sling, but he was healing well. Behind him stood a man in full dress whites with the insignia of a Navy SEAL commander. Commander Mitchell, the SEAL commander said, standing at attention. Then, in perfect unison, both men snapped a salute so crisp it could have cut glass. Sarah stood and returned the salute, something she hadn't done in years. At ease, gentlemen. Ma'am, I'm Commander James Harrell, SEAL Team 3. I wanted to thank you personally for saving Petty Officer Rodriguez's life, and I wanted to deliver this. He handed her a framed certificate. It was a commendation from the Naval Special Warfare Command, thanking her for her continued service to SEAL personnel even in retirement. Sarah's eyes filled with tears as she read it. I don't deserve this. Yes, ma'am, you do, Petty Officer Rodriguez said. You saved my life, and according to the guys I've talked to, you saved a lot of lives over the years. You were part of the team then, and you're still part of the team now. Commander Harrell added, we heard about your new veterans unit. If you need anything at all, SEAL Team 3 has your back. Training, resources, guest speakers, funding, you name it. Thank you, Sarah whispered. That means everything. After they left, Sarah sat alone in her office, holding the framed commendation. She thought about her 20 years in uniform, the missions, the wounded operators she'd saved, the ones she'd lost, the young man who had died in her arms and made her realize she couldn't keep doing this forever. She had thought leaving the military meant leaving that life behind completely, but now she understood. Service didn't end when you took off the uniform. It just changed form. She was still serving, still healing, still making a difference. Just in a different way. That evening, Sarah returned to the emergency room one last time to say goodbye to the staff before officially transitioning to her new role. The entire department was waiting for her. Doctors, nurses, technicians, even the cleaning staff. Dr. Hammond stepped forward. Commander Mitchell, we wanted to give you something. He handed her a plaque. It read, Sarah Mitchell RN, hero, healer, teacher, friend. Thank you for showing us what true service looks like. Sarah couldn't speak. She just nodded and wiped her eyes. Emily hugged her tightly. "Thank you for teaching me to be brave." Patricia squeezed her hand. "Thank you for reminding all of us why we became nurses in the first place." Even Dr. Chen and Dr. Porter approached with genuine gratitude in their eyes. As Sarah drove home that night, she thought about how strange life was. She had come to this hospital expecting nothing, wanting nothing except to quietly do her job and heal from her own wounds. Instead, she had found purpose again, not through combat or heroics, but through the simple act of showing up every day with dignity and compassion. She had been mocked, underestimated, and disrespected, but she had never wavered. She had never compromised her values. She had simply been herself, quiet, strong, and unshakable. And in the end, that was more powerful than any weapon or rank or title could ever be. Sarah Mitchell smiled as she pulled into her driveway. Tomorrow, she would start her new position. She would help veterans heal from their visible and invisible wounds. She would build something meaningful. But tonight she would rest. She would honor the journey that brought her here, the battles fought, the lives saved, the lessons learned.